Thank you, Sanjana, for the kind introduction. Good evening, everybody, and greetings to my esteemed co-panelists. Regards and best wishes to all our senior citizens on World Senior Day. The world population is aging. People are living longer. I feel it's a privilege to live longer, but we should count our blessings if we can lead a healthy life. We should live long and a healthy life. My research work mostly concerns cancer in the older adults, and today I'll be speaking to you about this disease. What are the challenges faced by the patient or the healthcare giver? What are the signs and symptoms we should be looking for, we should be aware of, so that we can diagnose this condition at an early stage? We'll be talking a little bit about cancer in the older adults, how it is different from cancer in younger adults. In the treatment, when we try to treat an older patient with cancer therapy, the coping power is much less than a younger adult. Also, as in an older adult, cancer may not be the only problem that the patient might be having. The patient might be having side by side many other diseases or comorbidities that I just told, that they might be having different diseases which have to be managed together with cancer, which is not there in younger age group. Also, there are some age-specific problems like difficulty in hearing or vision, difficulty in balance, more falls. There might be difficulty in memory. There can be dementia or forgetfulness. So these all things can plague an older person who is having cancer. So having a cancer in older age is like a two-edged sword. So there is a cancer to be taken care of, and side by side there might be so many other comorbidities that have to be managed. So this proves a challenge. In old age, there might be other issues like financial dependency, emotional dependency, psychological issues like loneliness or depression, which might aggravate the problems already faced with cancer. And this all has to be during management. We have to think about all these things. There has to be a holistic management to the signs and symptom, what we should be aware of. So some of the general signs and symptoms of malignancy are sudden unexplained loss of weight, loss of appetite, feeling of tiredness, pain in the body, different parts of the body, or a continuous fever. The issue is that all these symptoms may happen in old age also. As one might think, older person or people in the family or other caregivers might think that this is because of age, and they might not seek medical attention for this. What happens is, therefore, that they present at a delayed time at a advanced stage of cancer. So these people should be aware of these issues. If there is any kind of weight loss, if there is any kind of loss of appetite, or is there a continuous fever, people should seek medical advice. Then there are some specific, site-related symptoms of cancer. So different sites present differently. So if there is a continuous cough, a new cough that has developed and it is not responding to any kind of treatment, we should look into, um, uh, chest X-rays should be done, lung cancer should be ruled out. If there's any lump in the body, say a breast lump is there, or a lump in any other part of the body, that should be investigated. If there is bleeding from private parts in older ladies, then we should look into cervical or uterine cancers. We should investigate more. If there is any change in bowel habits, like a person who is having a regular bowel habit suddenly develops constipation or suddenly has continuous loose motion, then we should investigate why this is happening. Anything, you know your body best. If something is happening to your body which should not be happening, which is something new, if there is a pain, a new nagging pain in the lower back area, or if there is a continuous headache, or if there is difficulty in digestion, lot of difficulty, and you feel that the food is sticking in the throat. So these things have to be in. Now, how to do we do screening of cancer? So In India, some cancers are very prevalent. So, depending upon our habits, so many people take pan, gutka, chew tobacco. So, oral and mouth cancers, tongue cancers are very common, and screening can help pick up these cancers at an earlier stage. Cough is developed, or like all the symptoms that I said, they have to be investigated. What are the preventions? First and foremost is a healthy lifestyle. So we need to take care of our diet. Healthy diet is goes a long way in keeping you healthy. A healthy, nutritious diet, a balanced diet, regular exercise. Some kind of moderate exercise should be carried on to the old age, keeping the joints mobile and walking or keeping oneself active. It's very important to keep healthy and maintain a healthy lifestyle. About management of cancer in the old age, what should be our aim? So it is much different from cancer in the younger age. A younger adult has much life left to live. So always the aim is to cure the cancer, how aggressively we can treat the cancer. Same is not true about old age. In old age, people have lesser life to live. They have limited life left to live. So the focus should be on maintaining that remaining quality of life. How best we can support them if the cancer, mostly older patients, they present at a later stage of cancer. While drawing a management plan for the older adult, all these things need to be taken care of, and a comprehensive and holistic care plan should be made. So in an older adult, mostly since they are dependent, caregiving is something very common. But if they are plagued by chronic life-threatening disease like cancer, they need, or dementia, they need constant caregiving. And mostly caregiving is informal in our settings. So informal caregiving means there is no specific training given to the caregiver, and the caregiver is mostly a family member. Either it might be a spouse, or a son, or a daughter, or a daughter-in-law, somebody in the family who takes the duty of caregiving for the ailing elder person. So coming to the end of my presentation, I think I need to thank Senocare for such a um, you know such a good initiative and a humanitarian initiative. It was my pleasure to take part in it. Thank you very much. Thank you, everybody.